Hi, I'm Dr. Frank Lista at the Plastic Surgery Clinic. We just finished doing consults today seeing patients, and a patient asked me a really good question. And the question is it safe to do more than one operation at once? I'm thinking of having my tummy and my breast done. Should I do them together or should I do them separately? Well, there's advantages to doing operations together, and the first thing that we tell people is that for some operations it's perfectly safe to do two operations at the same time. In fact, it's probably safer to do two operations together and have one anesthetic than to do them separately and have two anesthetics. If you're going to do two operations separately, you have to separate them by at least 6 months to reduce the risk of a complication called DVT, or blood clot in the legs. So if you're going to do separate operations, they need to be separated by a long time. But doing them together has many advantages. First of all, it's only one anesthetic, which is safer. It's one anesthetic because it's a little cheaper, so there's a little savings to us, so we pass that savings on to the patient. But most importantly, it's one recovery period. So, for example, if you're having breast surgery, recovery period for that may be 1 or 2 weeks. If you're having tummy tuck surgery, the recovery time for that is 1 or 2 weeks. If you do them separately, you need twice the recovery time. But if you do them together, it doesn't extend the recovery time. So if it's 1 week for your breast and 1 week for your tummy, then if you do them together, it's just 1 week, not 2 weeks. So the answer is that it's safer, cheaper, and just more convenient to do two operations at the same time. My partner, Dr. Ahmed, and I just published a paper this year in the Journal of Aesthetic Surgery where we looked at patients who had tummy tucks, and about half of them had two operations at the same time, and those patients were done perfectly safely and had the same risks and complications. They didn't have a higher complication rate than patients who had just one operation. And you know, the thing that I hear is if a patient's having their breast and thinking about doing their tummy, then after they're all healed after their breast, they say, you know, I wish I had done my tummy at the same time because I'd be all healed by now. The common operations that we do are breast surgery and tummy tuck surgery at the same time, and or breast surgery and liposuction. The breast surgery can either be breast lifting, breast augmentation, or breast reduction. Other common operations are doing nose surgery, rhinoplasty with a breast, or ears with the face. So it's possible to combine operations. It's perfectly safe, safer, convenient, cheaper, and just better to do them. If you're going to do them together under one anesthetic. So yes, it's perfectly safe to do two operations at once, and if I was thinking of having two things done, that's how I would do it. I'm Dr. Frank Lista at the Plastic Surgery Clinic. Thanks for watching. Follow us on Twitter or Facebook or on our YouTube channel or even on our website where we're posting frequently asked questions all the time. Thanks.